I'm Ernstine Weidenbach. I was born in 1900 in Hamburg, Germany, and I moved to New York in 1909. I earned a Bachelor of Arts degree from Wellesley College in 1922. I earned a registered nurse's license from Johns Hopkins School of Nursing in 1925. I earned a master's degree at Columbia University in 1934. I earned a nurse midwifery at Center Association School for Nurse Midwives in New York, and I taught till 1951. I was an instructor at Yale University in maternity nursing in 1952. I was an assistant professor of obstetric nursing in 1954. I majored in maternal and newborn health nursing, and I was an associate professor at Yale University. My theory is perspective theory, which developed my model of nursing called the helping art of clinical nursing. Perspective theory is defined into three factors: the central purpose which the practitioner recognizes as essential to the particular discipline, the prescription for the fulfillment of central purpose, and the realities in the immediate situation that influence the central purpose. The theory explains that knowledge encompasses all that has been perceived and grasped by the human mind. It may be factual, speculative, or practical. Perspective theory applies to my model because the model consists of identifying a patient's need for help. The helping art of clinical nursing addresses the definition of a person as well. The theory states that each person, whether a nurse or a patient, has a unique potential to develop self-sustaining resources. In my theory, self-acceptance and self-awareness are essential to integrity and self-worth. There are four main elements of my method: philosophy, purpose, practice, and art. The nurse's philosophy is about attitude and belief about life and how that attitude affects them. The three factors of philosophy are reverence for life, respect for dignity, worth, autonomy, and individuality of each human being, a resolution to act on personally and professionally held beliefs. The nurse's purpose is what the nurse wants to accomplish. It includes actions towards the patient for the overall good. The practice of nursing is the observable actions that are affected by the nurse's beliefs and feelings about meeting the patient's need for help. Art. For the nurse to understand a patient's obligations and concerns. To create goals and activities to magnify a patient's ability. Directing actions related to the plan of care to improve a patient's prognosis. Preventing complication from reoccurrence and new diagnoses. For the key terms of my theory, person is a nurse or a patient who establishes with their own potential to create self-sufficient resources. Health is not defined. Nurse, it is the practice of identifying a patient's need for help through the observation of presenting behavior and symptoms, exploration of the meaning of those symptoms, determination of the cause of discomfort, determination of the patient's ability to resolve the patient's discomfort, or identifying the need of help from the doctor and nursing staff. Environment. A business of procedures, items, policies, places, ambiance, people, happenings from past, current, or anticipated that are frustrating, complex, stimulating, unforeseeable, and disorderly. A research study that utilized my theory was coping, help, and coherence, a dichotomous theory for childbirth. Purpose of the theory: to propose a new theory that may be useful when explaining childbirth from the perspective of women and their midwives. The midwife determines if the mother needs help or assistance. The study is related to my need for help theory because the purpose of the midwife is to meet the woman's need for help. Midwives need to observe a woman's behavior, looking for clues, which seem inconsistent with her continuing to cope with what she is experiencing in labor, whether the labor appears to be normal or not. The new theory utilizes my philosophy, purpose, practice, and art. Philosophy of the new theory: a personal stance of the midwife that embodies attitudes towards reality in labor and birth. Purpose of the new theory: normal birth is desirable. Intervention should be avoided. If necessary, but may be used judicially, if thought to be potentially helpful. Art of the new theory. Pain in labor is normal, but some women may need help with it. Practice of the new theory. The overall good, the purpose of midwifery is to facilitate efforts of women to cope with labor and birth, overcoming obstacles which interfere with their abilities to respond capably to demands made by their condition, environment, situation, or time. The goal of the midwife is to identify if the woman can meet their own need of help and knowing when to step in to utilize their skills to help the woman. The study interviewed pregnant women to understand their perceptions of childbirth along with their midwife. Results of the theory: it recognizes that the woman in her body can be trusted to express a need for help, if necessary, along with the vital nature of the midwife's skills to recognize when help is needed and what that help might be. Conclusion is understanding the uniqueness of each woman's pregnancy, understanding their experiences, and the value of the ability to cope by the woman and the midwife during the labor process. The art of nursing includes understanding the patient's needs, developing goals and actions intended to enhance the patient's ability, and directing the activities related to the medical plan to improve the patient's condition. The nurse's focus is also on the prevention of complications related to the reoccurrence or the development of new concerns. My theory has related to many of my patients seeking care. One specific scenario is when my patient was suffering from alcohol withdrawal. I understand the patient's need by assessing their CWAS scale. By improving the patient's condition, the healthcare team decided to taper off her Klonopin during the withdrawal process. She was sweating, anxious, nauseated, and agitated during detox. I knew to give her Ativan as needed to make her more comfortable from these harsh symptoms. I assessed her and knew she needed help to prevent the recurring painful symptoms she was experiencing. I was a patient advocate and applied my art of clinical nursing. I feel this patient especially needed help because alcohol withdrawal can be fatal and detox should not be done alone. I develop a model that identifies a patient's need for help. The four main elements that make up my theory of clinical nursing are philosophy, practice, purpose, and art. The art of clinical nursing addresses the definition of a person as well. My theory will help many nurses address the needs of their patients and take actions to prevent further complications.